Okay, welcome to my presentation, Exercise and Age-Related Decline, also known as Getting Old Sucks. So first we're going to start off with some physiology background. Obviously, we're going to age and our bodies are going to fall apart because that's just the natural process of aging, and that was the way God had designed it. However, this is happening at an increased rate due to our sedentary lifestyle and the impact of obesity on all of the physiological functions of the organ systems in the body. Now, the current challenge for now is going to be promoting a healthy lifestyle and healthy changes as people are aging, because now we have people who are living longer. And one of those things is going to be decreasing VO2 max. This is something that happens naturally as we age. However, VO2 max is actually very important in maintaining body functions. It measures the maximum amount of oxygen your body can use during intense exercise, which is going to reflect the efficiency of the heart and lungs in the body. And this is important because it's going to be helping people maintain independence with things like just going up and down stairs, grocery shopping, chasing grandkids, all of those things. It's going to help protect the cardiovascular system against things like heart disease, stroke, heart attack, and having a low VO2 max is a strong predictor of an early death. And then VO2 max has also been associated with better mood, more energy, and then greater mobility, and it slows down physiological decline as we age. Another thing that's going to happen as we age is a decrease in skeletal muscle. As we age, we lose those fast twitch muscle fibers, and there's an increase in slow twitch muscle fibers. And muscle weakness in the elderly can be very bad because it increases your risk for falls and it reduces your ability to perform activities of daily living, which can result in a loss of independence. And preventing falls is so important because a lot of people die from falls every single year. I had a friend whose grandmother literally passed away because she fell and broke her hip. She was living alone and she didn't have a phone or anything in the room with her. So she literally died because she could not get herself up off the floor. And then there's two phases in skeletal muscle decline. And there's a slow phase, which is 10% of total muscle mass loss between ages of 25 and 50 years old. And then there's a fast phase where 40% is lost between the ages of 50 and 80 years old. So by the time you're 80 years old, you have lost 50% of your skeletal muscle mass, which is not great. And then as we can see from this chart, aging and sedentary lifestyle, malnutrition, prolonged inactivity, so things like bed rest, and then combined with our increase of diseases, so diabetes, cancer, injuries, obesity. And then as you age, your body's ability to synthesize protein decreases as well. So increased protein breakdown and decreased protein synthesis is going to result in a loss of muscle mass and strength, and that is known as sarcopenia. Okay, cognitive decline. This is something else that also happens as you age. Impaired cognition can include memory loss, impaired speech language skills, depressed executive functioning, and then impaired visuospatial processing. And age-related failures in cognitive function are associated with a decrease in gray matter, which is neurons in the brain, and a change in structures and functions in the synapses in the brain as well. And with that reduced gray matter, you can get things like Alzheimer's and slower processing abilities, reduced working memory issues, problems multitasking, recalling information, things like that. And there's mild loss of this gray matter at 45, but it rapidly declines after age 65. And one thing I found interesting is, I know this isn't technically a cognitive decline or a cognitive disorder, but I stumbled across this guy on Instagram. His name is Jimmy Choi, and he was diagnosed with Parkinson's in 2003, and his neurologist told him to give up on exercise completely, and he probably was going to be in a wheelchair by the age of 45. Well, he essentially said, F you, I'm not going to do that, and he became an American Ninja Warrior, which I think is absolutely incredible. And today he is 50 years old and he is not in a wheelchair. He is still exercising. So that just shows to prove that exercise can be absolutely impactful for the body as well, not just for cognitive abilities, but also these dopamine producing neurons in the brain that are associated with Parkinson's disease. Another thing, osteoporosis. I think we're all too familiar with that. We typically hear of old ladies who have these brittle bones. I know I heard this one story about this old lady who got crushed in an elevator and broke her pelvis. However, the elevator was stationed to only produce 5 pounds of pressure no matter what was in the door, which is not a lot, but her bones were just so brittle that 5 pounds of pressure just completely crushed her pelvis. And then with osteoporosis, it can happen with things like reduced physical activity, and then aging, and then sarcopenia as well. Sarcopenia and osteoporosis are often found in the same patient. This reinforces the critical link between physical inactivity and the loss of both bone and muscle mass. Bone loss starts at age 30 and can be debilitating by age 60. One thing you can do to prevent lots of bone loss is literally just to exercise. There's this thing called Wolff's Law, which the muscles exercise, or they move, and they put stress on the bone. And what that does is that bone releases electrical signals, which then produce osteoblastic activity, which then these bones are actually able to become stronger and repair themselves. So the use it or you lose it is not just applicable to muscle, but it is also applicable to bone loss as well. There we go. So I worked in a physical therapy clinic for a couple years, and one thing that I noticed was we had these elderly patients coming in who had horrible balance issues. So when I took on this topic, that was one thing I wanted to look into more, and I found this comprehensive review of these people who looked at balance intervention and importance of falls and reducing falls. And as you can see here, they found that the main cause of these balance issues across these studies that they reviewed was sensory decline, so things like vision, vestibular system, musculoskeletal weakness, so again, the osteoporosis, the sarcopenia, and then neural cognitive degradation, so again, losing that gray matter and losing those neurons. And then medications and chronic diseases. So some medications can cause dizziness, and then chronic diseases, obviously nobody wants a chronic disease. It's not good, right? And the consequences they found of this were increased falls and injury and decreased mobility and independence. So the interventions that they looked at when they were looking at these studies were exercise and strength training, and then also vestibular and proprioceptive rehab, and then multifactorial things like meds, environment, and then aids, so like VR, wearables, telemed, that stuff probably like a life alert. And what they found was there's a high prevalence of balance issues in people who are 65 and greater, about 30%, and then after 75, the 30% rapidly increases. And after they did this, they found that there's probably a need for more longitudinal and precise research and imaging and sensor tools, and then obviously community level prevention and access. Okay, another thing that I also found super impactful was the study that they did on postmenopausal women and bone mass density by using, or increasing bone mass density by using methods such as yoga or Pilates. And this is very near and dear to my heart because my great-grandmother had a degenerative joint disease, and her knee replacement actually ended up detaching from her knee. and she ended up passing away from that. So what they did is they looked at 5 databases and they found 11 studies on yoga versus Pilates using postmenopausal women, and they were all randomized controlled trials. And there was 591 women that participated across these studies, ages 45 to 78. And the duration of the treatment they used was 12 to 32 weeks, and it was yoga versus Pilates. And what they found was yoga and Pilates may improve bone mass density and prevent osteoporosis. However, it is not sufficient enough alone, and it needs to be coupled with high impact or resistance training to continue to stimulate that bone growth. And then another thing that I wanted to look at was exercise and cognitive function. That is such an important thing. I don't know about all of you, but when I'm 75 years old, I want to remember all of my grandkids, all of my kids. I don't want to be forgetting anybody or forgetting things. I want to be as intact mentally as possible. So what they did was they looked at these, it was a cross-sectional analysis of 2,549 adults ages 60 plus across the US. And what they did was they gave these adults moderate exercise snacks, which they defined as 2 to 5 minutes of moderate to vigorous exercise. And what they found was that quick, moderate to vigorous exercise snacks, even just a few minutes a day here and there, are meaningfully linked to improved cognition in older adults. The benefit rises with volume up to 90 minutes a day, and then you can taper off. And what they did was they would give them these exercise snacks, and they would give them cognitive tests as well. And at the beginning of the test, the mean for the data was 0.0001. And at the end of the test, all of the adults had increased that score, and the mean was 0.002.1. So while it wasn't such a significant increase, it was an increase, and I believe anything you can do to slow cognitive decline is going to be beneficial. Okay, so that leads us to practical application. This is most going to benefit older adults, obviously, who are suffering from this decline, but it's also going to benefit physical therapists, occupational therapists, geriatricians, and anyone that is going to work with this aging population. It's going to be applicable to rehab or training if you're a personal trainer who's specializing in old people and working with the older population, or if you, honestly, yeah, if you're just aging. And then in summary, getting old frickin' sucks. And while there's some things you cannot do to combat aging because that's the natural design of the human body, a sedentary lifestyle is going to be detrimental to aging, and it's going to have severe impacts later on. The most important thing you can do is exercise and include heavy resistance training so you can improve that bone mass density, and then improve skeletal muscle mass as well, because falls are no fun, and the thing we want to do most is prevent falls when we get old. All right, so that leads us to the quiz. So my 5 questions are, at age 40, VO2 max declines by how much per decade? Okay. Which type of exercise is especially beneficial for maintaining bone density in older adults? And then how does aging typically affect skeletal muscle mass? And then people with sarcopenia often have what disease as well? And then how many points did the cognitive score rise in the exercise snack study? Okay, and then here are the answers. At age 40, VO2 max declines 3 to 6% per decade. Resistance training is most beneficial for maintaining bone mass density. And then as we age, there's a loss of fast fibers and an increase in slow fibers. And then people with sarcopenia often have osteoporosis as well. And then the cognitive scores increased from 0.001 to 0.0021. And then there's my sources.